Hey everyone, this is a short lecture on quality. So what is quality in healthcare? The Institute of Medicine, IOM, has established recommendations for the new standard for nursing. They include these 6 core competencies: patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. So patient-centered care incorporates patient preferences, values, and expressed needs. The nurse should value seeing healthcare through the patient's eyes. Patients and families participate in decision-making and coordination of care. Nurses must respect diversity of individuals and groups, understand how diverse cultural, ethnic, and social backgrounds function as a source of patients' values, communicate these values to the healthcare team, and understand how patient and family values can differ from your own. Teamwork and collaboration. 66% of healthcare errors are related to poor working relationships and communication. Teams with effective communication demonstrate better patient outcomes. Essential components to patient safety is team training and enhanced communication. A standardized team approach should include sharing concerns, clarifying decision about care, and ensuring accurate information exchange. Situational monitoring assesses the environment and situations as they are happening. This is done with a checks and balance system, watching each other's backs. This builds mutual trust throughout the team. Situational awareness includes sharing perceptions to avoid confusion. Make sure everyone is on the same page and all are working towards the same goal. Structured communication ensures accurate information exchange, shared decision making, and reduces errors. Using an SBAR, as discussed in our communications lecture, is important when the physician calls out critical information, like if you're in a code or a trauma, so everyone can hear it. For an example, when the physician's doing their head-to-toe assessment and they're saying out loud what they're finding. Repeating back what is heard. So the physician says, administer 3 milligrams of epinephrine, and the nurse repeats that back, who's going to administer that. All team members support each other through encouragement and helping with tasks. Handoff communication, like bedside reports, is important and ensures that nothing's forgotten. And key phrases can be used by all team members to clarify information, such as CUS, I need some clarity, I am uncertain, and I have a safety concern. Or the 3 C's. I'm curious, I'm concerned, I'm still uncomfortable, so let's consult a third party. Evidence-based practice ensures safe, high-quality nursing practice. Nurses have to juggle constant changes in patient care with patient preferences. Evidence-based practice integrates best current evidence with clinical expertise to deliver optimal health care. Research helps identify valid reasons for modifying evidence-based practice. The use of EBP can increase quality and lower costs by identifying less expensive care alternatives and balancing the effectiveness of treatments with associated costs. An example is a typical presentation for appendicitis. With evidence-based practice, there's no longer need to do a CAT scan. This saves money, saves time, and is just proven with the research. Evidence-based practice proves that appropriate discharge instructions decreases costly readministration to the hospital, proves that delegating appropriate tasks reduces unnecessary costs, helps identify and reduce complications that decreases length of stays and therefore additional costs, and helps prevent hospital-acquired conditions like falls or infections, and therefore again reduces costs. Consumers demand quality-focused healthcare. Healthcare facilities encourage consumers to ask what, how, and why we do what we do. Services are customer-focused to provide patient satisfaction and long-standing relationships. The patient defines what quality is. Errors and near misses are investigated with quality assurance to determine what needs to be changed. Processes and protocols are improved to create better outcomes. All healthcare facilities must abide by regulatory standards and requirements. Medicare program and state licensing authorities require quality processes. Joint Commission was the first regulatory agency. They address levels of performance in key areas like patient rights, patient treatments, and infection control. And they require evidence of performance and continued improvement. Clinical indicators are measurable items that reflect the quality of care. They are used to monitor and evaluate processes and goals for quality improvement. They show how care is or is not carried out as it should be. There's focus on clinical actions or outcomes of clinical care, not on procedures that support the clinical care. So an example is administering the correct IV fluid at the correct rate qualifies for a clinical indicator. Replacing IV solutions on the supply cart supports clinical care but does not qualify as a clinical indicator. Process improvement tools support the quantitative understanding of key work processes. They all have common steps. To analyze and clearly understand the process, select key aspects of the process to improve, establish trial targets to guide improvement measures, collect and plot data, interpret results, and implement improvement actions and evaluate effectiveness. So a few different tools that you can use are, the first one is flowcharts. They map out what actually occurs during the process. A top-down flowchart lists the main steps and sub-steps of a process in a linear fashion, and a deployment flowchart maps out the steps of a process under headings, designating people or departments who actually carry out each step. A Pareto chart is a bar graph that selects key aspects within the process to focus on. The height of bars reflects the frequency that occur or the effect events have on a process problem. By focusing on just a few causes, a much broader effect can be achieved. A diagram that lists potential causes is a cause and effect diagram. It is arranged by category to show the potential effect on the problem. It's sometimes called the fishbone diagram because it resembles fish skeleton when it's completed. Cause and effect diagrams are useful after localizing a major problem by using the Pareto chart. A run chart measures data over time to evaluate patterns in process variation. You'll see these quite often used, sometimes called a time plot. Valuable information can be obtained by studying trends. Standardized processes, when effectively managed, are the foundation for improvements in clinical care settings. Clinical pathways define the optimal sequencing and timing of interventions by healthcare providers for a particular diagnosis or procedure. They are typically developed through a collaborative effort by the interdisciplinary team. The benefits are a reduction in variation of care, facilitation of expected outcomes, reduction in care delays and length of stays, and improvement in cost effectiveness while increasing patient satisfaction. Clinical algorithms are a decision path that a provider uses during a particular episode, like treatment of hypertension or providing life support and different diagnostic screenings. Case management matches the most appropriate services to the patient's care needs in the most effective, efficient manner. Safety initiatives focus on patient safety and error prevention. A just culture promotes learning from adverse events. Recognize that all healthcare workers are human and can make mistakes, but shouldn't be held accountable for system errors. Healthcare errors result from human factors like circumstances in the workplace, such as staff shortages, provider training or lack thereof, and provider interactions like the physician-to-nurse communication. An efficient quality insurance approach examines conditions and sets up defenses to avert future errors. And lastly, Informatics manages information and improves communication across the system of care. Ensures patient safety through improved information access and data management. So think of the snowbirds. They're receiving care in Wisconsin half of the year, in Florida the other half of the year. How is their information shared? Nurses in informatics have the knowledge and use technology to support evidence-based practices, quality improvement strategies, and unique clinical problem solving. So implications for practice or standards of care are evidence-based. Quality reporting is benchmarked against industry standards. Critical incidents are investigated within the just culture. Knowledgeable workers are rewarded. They are the ones who engage in their work, ask critical questions, and continually seek to improve outcomes of care. Quality assured hospitals report healthier work environments, higher levels of job satisfaction, and better employee retention rates. And the nursing profession's identity must be modified. What does it mean to be a respected nurse? They typically are caring, knowledgeable, honest, and have integrity, but also knowledge and commitment to quality and safety for themselves and their patients. And that's the end of our quality lecture.